Poor physical health and frequent hospitalizations, how does it affect child development? Introduction. The first 5 years of a child's life are a time of tremendous growth in many categories such as physical, emotional and mental, social, and cognitive. The conditions in which the child is growing has a big impact on their development. In this presentation, I will be explaining how poor health and frequent hospitalizations can have effect on not only a child's language development, but their overall development and well-being. For starters, we have physical health, which is clearly obvious. Preschoolers require a healthy diet, frequent exercise, and proper medical care. Without this, children could become at risk for poor health, which leads to frequent hospitalization sometimes, which then affects their overall development. First is diet. Children need nutritious food to keep them healthy. Children can concentrate better in and out of school if they are eating balanced meals. If they're not getting the nutrients they need, that could lead to poor health, which then can also lead to being hospitalized. Second is exercise. To learn to use their muscles properly, children need to do movements such as running, jumping, climbing, throwing and catching balls, etc. These are all things incorporated into a standard physical education class. If a child is missing school or not being able to participate due to poor health or hospitalizations, they are not getting the opportunity to do these things on the basis that they should be doing them. Not to mention that most of these activities, especially when incorporated into a physical education class, are social activities as well. Therefore, this also affects a child's social and language development. Next is proper medical care. Finding a good doctor's office or clinic for your child, as well as getting early immunizations for your child, can help to prevent a number of diseases that could potentially lead to frequent hospitalizations. Next is how frequent hospitalizations and poor health can be affected behavior and social life. During early childhood, navigating social scenarios is a vital skill that needs to be gained. They are learning how to converse with others, when to share and take turns, how to deal with frustration, and overall regulating their emotions. Being around other children is crucial to healthy social development for children. Children learn from their peers. When a child is absent from the classroom due to poor health or frequent hospitalizations, this limits time spent with their peers and children their age, which takes a big toll on their social development. Behavior and social life again, children who are in poor health or that are frequently hospitalized tend to be absent from school a significant amount. This can negatively affect their behavior, and their behavior affects their social interactions. Due to their absenteeism in the classroom, children who are in poor health or frequently hospitalized are not only not learning, but not getting the social interactions they need for proper language development and social development. Being separated from their peers so often or for such a prolonged period of time can lead to anxiety and stress in social interactions. For example, being in the classroom with other children teaches them boundaries. When they are not able to do these things, they might be anxious about what they are allowed to do and say and what they aren't allowed to do and say when interacting with their peers. This has a negative impact on their interactions with others and overall social development. To summarize this, overall, poor health and frequent hospitalizations have a negative impact on language development and just general development in a child. Being away from their peers and not learning in the classroom has a negative impact on their behavior and emotions, which plays a big part in their social interactions. Not having enough social interactions with their peers and children their age greatly affects their language development and their overall development.